We are coming up to the top of the hour. I think we're just seconds away. So I'm just going to go ahead and thank everybody who's come to join us today for these important return to the workplace webinars. There's the foundational information that Brennan will be going over, and then he'll be introducing our guests. We have somebody really exciting today. But it's my honor to introduce Brennan and Bright Talent. As you probably already know, Bright Talent is the resource for strategic HR people, helping HR teams and business leaders solve those people challenges. And Brennan himself is a former Fortune 500 HR leader. You know, he's worked for companies like Black & Decker and Gallup and Edward Life Sciences, and just has a plethora and a major experience across the board in change management and in HR leadership, HR strategy, from the Fortune 500 businesses to mid-size and smaller. So we've got it all, Brennan. Take it away.
I don't know about that, but thank you for the introduction. Thank you, everybody, for joining us. We're very happy you're here. You know, this is our 8th webinar we've been hosting every Friday since we recognized the return to work really was a project that we could help our community with. So literally 10 weeks ago, it occurred to us the way we left the workforce, how we were going to come back to the workplace was going to look very different. And so we started developing tools to help our community, developing tools for free to help our community get organized to come back. And then what's important is that, you know, a lot of companies, like our guest speaker today, who's Coleen Bentley, Vice President of HR for Orora Packaging Group, they never stopped working. So during our Q&A today, we have Coleen as our special guest, and she will share lessons learned in regards to how they actually developed and implemented these new practices while continuing to work. Many of us left the office, and some of us have returned back. Some of us never left, as I mentioned, and then some of us are waiting to even return. And so what we're going to walk you through here today is what we call the roadmap to return to workplace. And before I jump into that, I think Mickey Jo wanted to add another comment.
Yes, I'm so sorry. I did also want to just let everybody know who's joining us that we're not using the chat function today, but what we are using is the Q&A. So I just don't want you to feel ignored if I miss something in chat, and I'll be fielding the questions. So use Q&A. You can put them in at any time and as many questions as you want, and then we will get to them when we go into the Q&A section, both for Brennan and for Coleen. So thanks.
Great. Thank you. Appreciate that. And so as I jump into we have a prepared slide deck here for you to walk through. And as we go through this, I just want to set the agenda for you. So I'm going to give a quick snippet about us. Then we're going to talk about the assumptions of today, because they almost change, you know, if not weekly, daily, in terms of the assumptions we're working against. And then the planning that needs to go in to actually implementing the roadmap, and then the tools used to collaborate with your peers when you are putting new practices in place. And then we'll move into the Q&A. During that Q&A, we will answer any questions you have about any of the topics I'm covering. And then also during the Q&A, we will get into conversation with Coleen Bentley. So for the next 15, 20 minutes, I'll talk about this, and then we'll move into Q&A, make sure we have plenty of time for Coleen in this session. And so just to quickly talk about us, Bright Talent is an HR consultancy. We provide resourceful experts in HR advisory, project management, training, and talent acquisition. And we are a company that lives by our values. So our values are honest, so that we provide honest solutions. We do what's right. We're resourceful, accountable, and we're about community. And that's what this entire webinar, and that's what the roadmap to workplace is all about, is that our community has generously given to us over the last 10 years we've been in business. And so we really felt this was our opportunity to serve our community by helping everybody get back to work safely. And this entire program was more or less a brainchild of our team. And I should say Renee Maurer, who's head of operations, was a part of this and on the call, as well as Amy Watson, who's head of administration, on the call with us as well, and Mickey Jo, our head of client engagement, who's been so gracious in moderating these sessions. We all played a part in developing all these tools. And so it was not just me, so I cannot take credit. And so as we talk about the roadmap, so I have a project management background. And so when I look at HR, I look at HR as a functioning series of programs. And so when you look at it as a functioning series of programs, it's a lot easier in terms of my mind of looking at things and implementing things and then continually improving those things. So when we talked about return to the workplace, we really thought this is a change management project. So how do we look at this as a change management project and break it down? And so those are the tools we're going to dive into. But before we dive in those tools, there's some assumptions we're working against here. So we're going to work against today's data in terms of what we're hearing on the latest guidance. The project plan that we've developed is focused on returning your workforce to the workplace. We are now moving very quickly from planning, and now we're implementing and executing and learning. And so I want everybody to realize one of the assumptions we're working against: you're not ahead, you're not behind, you're right where you need to be, because everything that's being developed today is often evolving and moving very quickly. And so really the mantra we use around here is crude and effective. Don't try to be perfect and polished, because it's highly likely it's going to change. So I'm talking about when you put new policies or practices in place, it's bullet points, straight to the point, no confusion, so that your employees and your managers know exactly what to do. And so those project plans we develop so you can collaborate with people. And then we have a decision workflow to show you how to organize your workforce when you're returning back. And then the other piece that's becoming very important now as employee, or it's always been important, however, it's very becoming critical, is the employee health and resilience. And then what we're not going to talk about here is leaves of absence, any of the emergency acts, compliance, or employment law. We covered that later, and you can find that on our website. So here's the assumption. This is a change management project. The return to workplace is all over the map. As I mentioned, some are never stopped working, some are working a hybrid where they're doing remote and on-site, and then some just decided to wait till the end of the year or wait till this pandemic is done. And so it's really a very interesting, fluid period of time. And if you're trying to look for what's the right thing to do, you need to check with your local health agency, because guidance at the federal level, state level, county level, and even city level can differ. And so it's important you make sure you're looking at all levels to make sure you're doing the right thing. And the other assumption is we need to adapt. So this is the largest change management project in mankind, is what I say. We have all been forced around the world into this change, and now we're learning to adapt very quickly as to what is the next or best practice to move with this, because we don't know when the pandemic's going to end or if it'll return. Like as I sit here today, I'm starting to hear the news about potential spikes in other areas. We need to implement new policies and process to adapt to this. And then there's going to be ongoing adjustments. So everything we do today could change. So just be prudent and effective as you move forward. So the first tool we developed is a project plan. So when we set out to help our community get back to work, we realized that we need to build a project plan to work through all the necessary changes that have to be put in place. And so we broke it down into 6 categories. When we talk about building a project plan and we talk about building new practices to come back to the workplace, it starts with policy. So you need to either draft new policy, because most everybody has a return to work policy, but a lot of people don't have return to workplace policies. So you might have to draft some new policies as well as update policies. You need to have basically simultaneous with developing policies, you need to develop a communication plan so that you have the crafted messages for your overall employee population and also by function, depending on how any of these changes are impacting them. And communications is absolutely critical. The less you communicate with your employees, the more likely they're going to fill that void with assumptions and rumors and things that could be incorrect. So it's critical you're communicating with your employees, even if it's as simple as saying, we are building this plan, we will continue to communicate with you, even if they just get that simple acknowledgement from you. So communications is critical. And then as you build out that project plan, some of you are just a single office, many of you are single location, or single location with multiple functions. So it's important to break it down by function to understand the needs. And then you understand those needs, and you can look at what the needs are of the system, the facilities, and then on an ongoing basis, what are we evaluating? How are we tracking this? How do we know it's working? So this project plan can be found on our website at brighttalent.com in the pandemic support page under the roadmap tools. And so you could find this project plan. We also developed a project plan outline, and this project plan outline gives a review of what I just talked about in terms of what a project plan looks like. So you would use this project plan with the project plan outline with the project plan, and it would basically everything I'm talking to, it gives you all the instructions here of how we suggest you use that project plan. But it also embeds all the links you need for all the governmental agencies as well as other resources to develop those processes, those policies. It's all right here. So we just wanted to make this super easy for you as you develop your own practices. And so the project plan and the project plan outline. And then as you start implementing, I like to visualize things into categories. So when we think about projects, when we think about implementing practices, I like to break things down so we can really systematically, or systematically, if that's the right word, go through it. And so the practices you're going to be implementing, the 5 new practices that you're implementing on the left are restrictions, gathering restrictions, employee health and safety, infectious disease action plan in case there's a breakout, and then remote work. And if you could imagine communications being critical, and communications just overlays all of this. I didn't highlight it here because it really is something that overlays all of this. So that's communications is, as I mentioned, critical. And so real quickly, let me talk about employee health and safety. Typically, the infectious disease plan would fall under employee health and safety. However, infectious disease action plan, most of us don't have one. And when we had the COO of one of the largest Pizza Hut franchisees on here as our guest, he really helped enlighten me on the significance of this, because if there's an outbreak in your location, you really need a plan in place. So I'm highlighting it separate from employee health and safety because it's critical you have that in place in terms of what you do. And so when you look in these practices on the left, you can see the different areas, policies, facilities, systems, sanitation, that it impacts. So as I fill in this information for you, so as it relates to distancing restrictions and policies, we need to put the 6 feet apart in all of our offices and hallways, anywhere people are crossing paths or sitting near each other. We need to have gathering restrictions, meaning a minimum capacity to meet the distancing when we're in a specific room. So for example, if you have a room that can typically occupy with 20 people, it is likely down to 10 people now. And so you have to think that through. When we talk about employee health and safety, a lot of us are doing, or we have to do, health check processes before they come in. And then we also have to have high-risk exemptions for that employee population that meets that high-risk category, such as being 65 or older or immune compromised. When we talk about infectious disease action plan, we have to put in a step protocol to mitigate the spread. So we have to be very clear in terms of how we handle this scenario. And then as it relates to remote work, a lot of us went to remote work and we didn't even have policies for remote work because it was not something we normally operated as. So now that if you are offering remote work, which many of you are, you have to then set up who's eligible for this and what are the expectations for remote workforce. Then when we talk about facilities and distancing restrictions, we have to arrange the offices to accommodate these restrictions. And then in gathering, in terms of going into these facilities, we have to have clear signage with limits in all locations. In fact, some are changing their ingress and egress, how they come into the building and making it one way, so it limits the chance that people are crossing paths at less than 6 feet. And so I would say some organizations are going to that level and that detail. Employee health and safety. So how are we doing the symptom check? Are we doing it at home or are we doing it in the office? Again, there's mixed feedback as to the best way to do this, but it's important to have that all laid out. As it relates to the infectious disease plan, communications. Again, beyond normal communications in terms of how we're operating with these new practices, if there is a breakout, what are we communicating to employees? How are we communicating to employees that were actually directly impacted or potentially exposed? And then how are we communicating to everybody in that facility that this breakout happened and what we're doing to mitigate spread, so that, again, employees aren't left with a gap of what's going on. And when we talk about remote workforce facilities, if people are now working at home, there's still some requirements that they come into offices for periods of time. And so we have to accommodate that. What does that look like from a facility standpoint in terms of hoteling? Are they coming back to their own office or their own desk? Or are they just now being assigned a desk when they come in so they could work from that desk? So that's some of the significant changes coming out of this. And so that's why I'm highlighting them here. And then as we relate to systems, what are all of the different changes we have to accommodate? When we start moving facilities around and to accommodate the distance restrictions, we're talking about moving, power cables and network cables to accommodate this new office space. So what's the necessary power and connectivity to accommodate the distancing restrictions? When we talk about employee health checks, what are the thermal devices we're using if we're actually checking in the office? Are we using a handheld device, or are we actually have a camera? A lot of larger organizations are moving to thermal cameras to check people's temperature before they come into the building. What are those needs? That we have to think that through. And then when we talk about collaborate or remote workforce, what are the collaboration tools? Microsoft Teams, Zoom, Slack, any of these collaboration tools become even more prominent and more important as we're as a workforce, we're not working together, we're working remotely. And then what security do we need in place to assure our data is remaining secure? And then it relates to sanitation, which is something, most of my HR career, I haven't had to think much about sanitation, right? So now when we talk about gathering restrictions and we're going into a space and we're sharing a desk, what's the cleaning instructions for the use? Or for our conference room, what are the cleaning instructions? Employee health and safety, as I was earlier just chatting before we started. What are the PPE that we're providing employees? Are we providing masks? Are we providing gloves? These are things we should be prepared to provide them as they come into the workspace. And when we talk about infectious disease action plan, what's the disinfecting and cleansing plan so that if there is an outbreak, how do we shut it down? And what, more than likely, outside vendors that come in and do a deep clean of the facility. As I mentioned before, the COO of the Pizza Hut franchisee, unfortunately, they've had to shut down 12 locations in all this time because they never stopped working. And they've had outbreaks, unfortunately, happen within their stores. And in one store, they had to go through all 20 employees. And they had to shut down that store for 2 weeks. They had to throw out all the food, do a deep cleaning. So it's not to say that this is any of you are going to have to experience something as severe as that, but that is an example of what we have to think through. And then when we talk about remote work, what is the communal space, as I mentioned? When we're coming in and sharing desks, how are we managing that? So this is how I looked at this matrix in terms of practice to areas we really have to focus on and put it in place to implement. So next is to think about, so that's the operations side of it, the practices side of it, putting new practices in place. But now, how do we think about our workforce? That's the other really important thing. How do we organize our workforce as we're coming back to work? So I really felt there was a macro level. So we look at the employee pop at a macro level or by function, and then we can look at the employee population by employee in terms of how we have to think about this. So we built these workflows, and if you're looking at this on a small device, I apologize. These are all free for download off the website, and this is a bit of an eye chart, but I'm going to walk you through it. And for those of you hopefully on large enough computer screens, you can follow along. So at the functional level, and we have our employee population at the functional level, the first question we have to ask ourselves is, are they returning to the workplace or not? If they are not returning to the workplace, then we can consider them a remote employee. And then the next question is, once we've identified that so we're segmenting that population as a remote employee. And then the next question is, are they on leave? Because that's what I'm hearing from a lot of you, maybe this was more so in the beginning, less now, as we had the outbreak happening. Some people had to care for, either they were sick or they had to care for somebody that was sick, or their children were home from school, and it was unclear in especially the early days, how they're going to manage their time. Were they on leave or not? So are they on leave? If they're on leave, then you move to your leave policies. If they're able to work remotely, then we move down this category where we are making sure they have everything they need. So we're putting our policies in place, we're putting our practices in place, we're putting expectations in place, and we're communicating this to the employee in terms of what to expect as a remote employee. And then I'm just working down this flow here where we're always evaluating whether these policies and practices are working. You evaluate, you move to ongoing, and if they're changing, then we kind of come to the top of this flow to make the changes. So that's the flow for somebody that's working remotely. As it relates to a person returning to the workplace, which I'm going to go to my left now, returning to the workplace, so now they're a workplace employee. So you have this population now in this workplace employee category. And once again, are they on leave or not? So we'd work through that. And then, are they a workplace employee? They're not on leave, they've returned to the workplace. Then we're going to review, and this little box to the right is all the things I talked to you about in the project plan, all of the expectations now, that they come back to the workforce, the employee health check, maybe multiple shifts, maybe whatever we're doing, we have to communicate that to the employees. And once again, as we move down the flow, we're going to continually evaluate, are these practices working? And if they're not, then we're going to adapt and change and communicate to the employees. So that's what the employee segmentation or the employee categorization by function looks like. And then the next step would be at the micro level, where what does this look like from an individual employee perspective? So the first question we have to ask ourselves is the employee able to work? If no, then we're moving to our leave policies. And if yes, then the next question after that is, are they returning to the workplace? So if the answer is yes, they're returning to the workplace, then we would walk through all those steps that I shared with you under the functional workflow of how we would prepare them to return to the workplace to make sure they have everything they need. If they're not returning to the workplace, the following question would be, are they working remotely? And if it's yes, then we'd work through the same steps that I shared with you in the functional workflow of how we'd be preparing somebody as a remote employee. Where it gets a little tricky is they return to the workplace, no. Are they able to work remotely? No. So now we have an employee whose job, they could be 65 plus, immune compromised, who knows, and they are unable to work remotely and unable to work in the workplace. Now what? So the first decision is, do we want to retain this person? If so, we have to evaluate, how do we accommodate? If they can't work remotely, could we put them in an office space by themselves, or could we put them on a production line where they're isolated? So there's just different ways we want to accommodate them. If we're unable to accommodate them, we're just going to have to change their status. And maybe they moved into some kind of extended leave or furlough or whatever is the right decision. And I think this is where it's really important as we work through all of this. We have to treat each of these individually. There's no one size fits all. And I think this is where, as employees, as being servant leaders, we have to be compassionate and really, just because nobody asked for this pandemic. This is not a performance issue per se by any employee. So we need to handle each employee situation as best as we can for what's right for the business. And then from a compassionate point of view, how can we accommodate that employee the best we're able to? Which sometimes might mean lay them off, and so they get the unemployment benefits, which sometimes is not the decision you want to do, but it's the right decision. So that's like from the employee population. And so now we're going to move into our Q&A. But before Mickey Jo comes back on here and asks, what Mickey Jo is going to do is read your questions to me. I just want to make sure all of the government websites that we share with you in that project plan outline are right here, as well as some other resourceful links as well, such as our pandemic support. Casco Back to Work is one of our clients and friend of the company, and they've done an amazing job developing from a construction standpoint and tenant improvement standpoint, how to prepare your facilities. Fisher & Phillips is a employment law firm, and they've done a great job with all kinds of great resources on their website. And then Mickey Jo's own company, dealing with health and wellness, has this amazing tool to help you not only prepare and make sure how your facility stays prepared with all these new practices, and it goes beyond just how your employees are doing from a health check. It really, when we talk about resilience and mental health, it goes layers deep into there too to help you connect with your employees to see how they're doing. So we have all these resources here for you. So thank you for listening. And now, Mickey Jo, do we have any questions?
Yes. Thank you. Let's see, here's a good one. With quickly changing times, how do you stay on top of the stats and updates of COVID-19 as a company? So what specific sources would you suggest that they turn to?
What updates was it?
Just, I think, yeah, I think it just says staying on top of stats and updates of COVID-19 as COVID-19. So I think that's probably a couple different stats, right, but you can talk about that.
Yeah, and I think it depends on what context you're asking that question. So if I direct you to this web page, and there's really no one spot you can simply go to either, because it depends on what your need is. So for me, EEOC has been very helpful in outlining very specific things, such as can you not hire a candidate if they're actively had COVID? So how do we ask the questions if a candidate has COVID? So typically these questions we're trained not to ask because it can create discrimination. The EEOC has been very good guidelines in terms of what we can and cannot ask. OSHA, Department of Labor, coronavirus.gov, CDC by the local level. These are all very important websites for you to become familiar with as you're putting these policies and practices in place. If you're a member of CHRO, they've also done an amazing job at putting tools and actual templates for you as well.
Okay, and the last one, which I think is really good, I love this. What are you doing to keep morale up, and how often are you having task force meetings? Okay,
I'll answer. We'll create that question in A and B, because I think that's a fantastic question for Coleen to ask when we bring her on, and that can be part of her Q&A. What I'm going to share with you, obviously for our team, has just been constant communication. We're very small, but just constant communication. It's very small in terms of number of employees, but it's just constant communication, weekly communication. Any updates we see, any expectations, we're setting the goal. Is it changing? How are we operating here? What are we doing differently here? So we're just constantly communicating. And then as I'm in constant contact with clients and colleagues that are in leadership roles in mid to large size companies, and more or less they are doing the same, or at least, how do I say this politely, those that seem to be governing at a best practice level are constantly communicating with the team. They're opening doors, and they're opening their doors. They're making sure people have a place to go for questions. And I think what's really important, especially, let me just address it this way. The pandemic was significant enough in terms of such a big change that everybody's feeling a bit uneasy. It's change, it's uncomfortable, it's uncertain. And then now we have a dynamic of this social unrest and this social change right now, which is more or less compounding what people are already feeling about uncertainty and just kind of where they are at in this world. And then so there's points as a leader, you have to say, am I qualified? If somebody's coming to me with these questions, am I qualified to really deal with some of this? And this is where the mental health comes in. So if you don't have a hotline for employee mental health has professionals trained to talk people through their emotions and what they're feeling, that is something I would seriously consider. And oftentimes you can get resources through your employment benefits brokers and things if you already don't have these practices in place, because we have to, as leaders, we have to kind of know the line there of we're getting way out of our comfort zone. And so we want to make sure we're giving our employees what they need to stay healthy, not just physically, but also mentally, as we go through this incredibly dynamic time.
Yeah. And if I could just add.
That's 1A, and I'll save it.
Oh, I just wanted to add to that hotline, or if you are providing a resource for people to talk about their emotions or how they're feeling about things, they don't necessarily have to be therapists or counselors. They can also be nationally board certified health coaches who are trained to, because health coaches can work with people in helping them move how they feel, but what they don't do is diagnose. So there's different types of resources is all I want to,
Yes.
I guess, offer. And then one of the other things that we talked about last week, Brennan, was on the morale part, was that, as HR, especially when some pretty serious things are going on, we are called sometimes to be heavy-handed about our communication with the policies, with new policies, and to add a message to that about the caring message, right? HR is also the given permission to be kind of the beating heart of an organization and to add the caring message, because peace of mind is such a huge need right now. So we just talked about that last week.
Totally agree. Yeah, no, I think that's a great point. And so when we talk about morale, those are, I think the more real you are as a leader, the more communicative you are as a leader, the more vulnerable you are as saying, look, we don't have all the answers, but based upon the data today, this is how we feel the best decision is. So the employees understand how decisions are being made. I think then you have a better connection, and you have then just increased the morale. And it's never to lose sight of vision for the company, never to lose sight of what we're doing that, but also to give hope. Hey, together we're going to work through this, and more than likely we're going to even be better. And so that's, to me, how we impact morale. So with that, Nikki Jo, I'm excited. So if you want to, while I introduce Coleen, if you can bring up her, I'm so excited to have Coleen Bentley join us. Coleen is a client and a friend of Bright Talent, and Coleen is Vice President of HR for Orora Packaging Group. And so what is unique here and why we invited Coleen is she reminded me in her email as I invited her to come speak, she said, we never stopped working, so which is just amazing. And so as we've gone through this, entered into this pandemic and worked through it, Coleen and her team and just the leaders within the company have had to build and implement and communicate this to all their employees. So she was so gracious enough to come join us today and then share with us some of the lessons she has learned along the way, and I'm sure she's still constantly learning. And then Coleen, can you hear me? Thanks for joining us.
I can hear you. Thank you, Brennan. I'm delighted to be here.
Awesome. Thank you. And maybe Coleen, for context, as you jump into your speaking points here, maybe just for context, share with the group, the size and scope of the organization so they can have some context to that.
Okay, I'm responsible for two different businesses. We have about 3,500 employees here in North America. And when the pandemic occurred, we ended up sending 2,000 people to work from home remotely, basically overnight. It happened in a week. But we had another 1,500 that remained on site. We're an essential business, and we're in the packaging and manufacturing business. So all of those groceries that you get, well, they're delivered in our packaging, and all of the medical equipment that is at the hospitals, we provide and we source to make sure they have masks and things like that. So again, being a part of that is very important to us. And so we have drivers, we have warehouse workers, and we have manufacturing facilities open in 80 sites in 3 different countries in North America, so Canada, Mexico, and the US, in a variety of different sites. So it's very, we're taking care of a lot of people, making sure that they're safe, certainly at home, and we feel really good about the 2,000 people that are home, that they are, we've kept them safe there, and then it's up to them. But the people at work every single day, we do a lot to make sure that they're safe at work, and that when they go back home to their families, that they're not bringing anything back to their families. And we're looking at how do we, and when and who we would bring back from telework right now.
That's great. Thank you for that. And yeah, quite a large organization by many standards, and quite the mobilization of the employee population. So, Coleen, as this unfolded, what are some of the lessons learned in regards to rolling out these new practices as you were putting 2,000 people into a remote situation and remaining 1,500 on site?
Yeah, because you're focused on returning people to work, I'll focus most on that. But just like you talked about, and probably everyone on this call, it's a constant learning situation. And as you learn something, you implement something new. But as we sent people home, we had to deal with everything that Brennan talked about. Well, what is our telework policy? We didn't have anything. We had a few people who were working from home, and it was, there was nothing formal about it. So we had to formalize that, and we had to make sure that they had the resources that they need, and we had to make sure our managers knew how to do that. So we put in some training to help people understand, well, how do I manage people from home? How do non-exempt people work from home, where we've always said, no, they could never work from home because of the control aspect of it. So all of those different things had to be put in place and put in place pretty quickly. But it's for the people who were at work. So what we put together first is we started above policy, and we started with strategy. And we said the most important thing for us is safety of our coworkers. We call them coworkers, not employees. I'm very used to it. Our coworkers, our customers, and anyone who visits our sites. So that whether that's vendors or anyone else, over finances, over anything else. And so we put together a crisis management team that, in fact, using the CDC's pandemic preparation, it was built on a flu pandemic because they hadn't even put that together yet. But what are the risks, and what do you need to make sure you're preparing for, and what should you think about? Because how do you manage it? So first, that team was the most important thing. And it's some of our senior leaders, because you have to govern it. You have to determine how will we make decisions? What will we do when and if, and there will be outbreaks, because no matter how much you control putting in place all of the temperature checks and the healthcare checks and the social distancing and wearing masks and having people wash their hands and keeping them 6 feet apart, people will go to parties, and they will go and because after a while they get tired of it, and they just want to see their family. And I'm just going to go to this one family birthday party because it's grandma's 80th, and she's only going to turn 80 this year, and so I'm just going to go to that. And it's a small group, but not knowing that small group has gone to other small groups. So really, it's 20 people, but it's 100 people there. You just don't see it. And so they bring that back into work. And that's what we're finding is happening. So the other piece is we have a small sub-team, which is the president, me, our legal officer, and our health and safety officer, and our finance. And we make decisions quickly. And we get together anytime that there's a situation. And so that, to me, is one of the major learnings, is think about what would happen and could happen. You put all of the things in place that you're talking about. You have your policies. You've been communicating. You've thought about the functions. You've thought about your systems and your facilities, and everything is set up. Now what happens when something goes wrong? Because it will. And we try to think about it ahead of time. Well, how will we pay people? If we have to shut something down, will we pay people? And for how long will we pay people? Okay, well, we said the incubation period is 14 days, so we'll pay people for up to 14 days. Well, what if they get sick at grandma's party? Well, we're not going to pay them for that time off, but we're going to require that they take time off. But we want to make sure we have heart, like Mickey said. This is new for everybody. So we'll allow people to use PTO, and we'll also allow their PTO to go negative 14 days. So we tried to think of all of the things that could happen and adjust to that. And then you never can. So we use the cdc.gov. I look at it literally every single day. because they're learning and they're changing things and they're adding things. And then, you know, a state or a county will make an order. So you have to keep up, and it depends. If you're just in one city, then all you have to do is keep up with that city. But again, we're in 80 different sites across the country. And again, like I said, even 3 different countries. So we have to look at more different things. And then, like you said as well, the EEOC, previously it was, no, you cannot require testing for your employees. Well, they've changed that, and now you can require testing for your employees. So you have to look at these sites often and keep educated, and it is a constant view. One of the things I have as that is helpful for me is I'm the head of human resources. I'm the head of environmental health and safety. That reports to me. And also I'm the head of communication. So it's kind of been the perfect trifecta of 3 different areas that I'm responsible for this pandemic.
That's actually a blessing, I'm sure, Coleen, because you're able to orchestrate much better that way. Perhaps if those were all separate leaders, you know, you were having to collaborate with, per se.
Right.
Well, thank you for that. I mean, that is great information. And I'm sorry, were you going to say one more thing?
Oh, I was just going to give her a quick question. Now, it sounded like they focused a lot more on strategy than policies, but somebody did write and ask for Coleen, if you made policies and if you've had to change them quickly, or if you basically focused on strategy and procedure, how did you handle that?
Thank you. Yeah, both. So we were clear on what our strategy was, and then we had to put in place policies and directions. So we tended to call them guidelines because they changed so often, but we had guidelines on how we would pay, and then we had manager and employee FAQs that we would put out, but we found that we'd have to update them often and then put them out again because, again, things changed. Whether it was, now we're taking temperatures every morning before you come in, and that's a requirement. Masks weren't required at first, and it was voluntarily. Well, now we've made it required. So as we've learned more, or as either city, state, county, federal orders have changed, we have changed and updated our policies about what we're doing and what we're communicating to our coworkers.
Great. And I think, Mickey Jo, we had that question about morale. Can you ask that question again?
Yes, that we were chatting about earlier. Just what have you done specifically at your company to keep up morale? And have you had things like town meetings and things like that?
Yeah, I'll answer that, and then I'll answer the how often we met as well, because I think you had that one. So we have an employee assistance program, and we have been communicating the heck out of that to everyone. And we found that we didn't have one in Mexico and we didn't have one in Canada. So we went out and made sure that we got that so that our coworkers had a place to call in, and we've made sure of that. We've done some education of our supervisors on the EAP and how to be aware of it and how to refer people to it and how to talk about it, and that it's really positive. Now, as a company, we have done a lot with that in the past anyway, so people have known about it, but we've made sure that they really know about it. We have a hotline that there's 2 different hotlines that people can call into. So we've again reinforced that, but we have done a lot of communication, a lot from our ghostwriter for our president. So he's had regular cadence of communications that are posted to help people understand what's going on. And when we did have an outbreak in one site where we brought in a mobile testing unit, and we found that we had people who were asymptomatic who didn't know they had the virus, and we were able to shut it down and clean and move forward from there. And we've had nothing since. We were very transparent about here's what's happened, here's what's going on, and here's what we did, and to stop rumors and to make sure people knew the truth of what was going on. Anytime we would have someone with a positive case, we never identify the person. They usually know anyway, but we never identify the person. But we say, here's what happened. You were not a close contact, because contact tracing is really important. Was there a close contact? Was there just casual contact? Because you do different things based on that. And we let people know that it happened and what we did so that they're comfortable. And what we have found is at first people were very worried about being at work and coming in. But now we're 3.5 months in, people feel almost more comfortable at work than they do anywhere else, because they know how serious we are about this, and we're holding their managers accountable to it as well. That helps answer that question.
Yeah, Coleen, can I ask you, so you said you brought in a mobile unit for testing. How did you go about getting that mobile unit?
We found it online,
Okay.
but it had to meet our criteria. We're not, so I feel like I've become a mini expert in this. Like I'm going to put an MD on the end of my name, which is, I'm nowhere near qualified for that. But we have found that, again, through research, the rapid testing gives 50% false negatives, so we're not using that. So we made sure that they're using antigen testing, and there's only certain types of testing we'll do. It helps that I have the assistance of a very qualified director of environmental health and safety. And I know not everybody has that. So you have to do more of the research yourself, but I do a lot of the research as well. So we make sure of that. And we've been very directive to our leaders that you don't get to go out and find testing yourself. This is all coordinated centrally. All decisions are made through the CMT. This is not a figure it out on your own. It is very much controlled through me and our president. I lead the crisis management team. So I do have control of that, again, as a partnership with very closely with the president, the CFO, and the general counsel.
Great. And I have one more question before you go over to the town halls and the meetings and things. I also heard you say, which obviously makes perfect sense, that you would ask people, or you would find out, what kind of contact you had. Without identifying a person, how did you go about doing that? Or was it just the department? How much contact did you have with the department? Or how did that roll out on the ground, I guess?
Yeah, so the first person you ask is the person who is sick. They've told you you're sick. They're sick. They have to, right? They have to tell us. That's one of our requirements. And so we ask them, okay, here's what close contact is defined as. Were you in close contact with anybody? Looking back 2 days, it's 72 hours from the time that you were identified, started getting symptoms, to the day you told us and that you were at work, your last day at work. So we start there, and then we go to people. And again, without identifying a name, we say, you might have been in close contact. Do you recall this? And sometimes we might have to give a name if it gets down to their close contact, because we need to know, and we need to know for their own health and their safety as well. But if they said, oh yeah, Joey, I just passed him in the hallway and it was never for 15 minutes or more. And we didn't shake hands, and we weren't in the same shared space, and I never touched the same machine he did, then it's a casual contact, and we just follow the casual contact guidelines.
Got it. Thank you. I think drilling down to that is really helpful, and it sounds somewhat situational. But would you like to move on to the part of the question about the townhouses? Sorry, town meetings.
Yeah, the crisis management team meets. At first, we met daily. It was every day at let's say 11 o'clock for a half an hour. And then as the process got put in place and we had a cadence of what we were looking at, and we looked at everything. I mean, this was HR, this was the business. How was COVID and the pandemic affecting our people, and our business. And our, and our customers, so financial, et cetera. So we had financial updates as well as, but we started with people and health and safety. And now we meet once a week because again, we have more process in place, but the situation or the quick response team, that team meets anytime we have a positive case so that we review all of the situation and we are consistent about what we do and how we apply it.
Thank you. I don't think there's any more questions, Brennan.
Okay, great. Coleen, just not surprisingly, you are completely buttoned up, as they say, in terms of how you put all of this in place. And I like that term, on the fly, build while flying. And I am so impressed listening to you. I already obviously have a high degree of respect for you, but just so impressed listening to how you were mobilized, how the leaders kind of all fell in line within your business and how they all saw the importance of this. It's just really impressive to hear your story and how you've done this and how you continually move forward. And I'm just grateful for having you on and sharing the lessons learned for this. And I know for those attendees, I'm sure they're taking away some great nuggets in terms of what they could go take and implement themselves. So thank you so much for taking the time to join us today.
It's my pleasure. Thank you, Brennan. I think it's a great opportunity for all of our leaders to see HR in a very high leadership role.
That's a great point. Really great point. Because, ultimately our focus is people, right? And this is a people issue. And so we should be leading the way. So thank you for that. So thank you, everybody, for joining us today. Just again, so grateful for Coleen and also for all of you joining. And please continue to look for our next webinar, as that we will have more subject matter as well as other subject matter experts join us to share, as we're all learning together, how to manage through this pandemic. So everybody have a wonderful weekend, and thank you for attending.